ALL, Acute Lymphoblastic Leukemia or Lymphoma. The word acute represents two very important points. One is the aggressiveness. The patient presents within weeks after the appearance of the symptoms. And second, ALL is most common in younger people. Yes, it is the most common cancer in children. The point here is that it is the most common cancer, not the most common leukemia in children. The second word is the lymphoblastic. Lymphoblasts actually forms more than 20% bone marrow cellularity. The third word here represents leukemia or lymphoma. In case of leukemia, we have the neoplastic cells that are freely present within the blood, whereas in case of lymphoma, the neoplastic cells they aggregate together and form a mass. Before discussing the pathogenesis and morphology and clinical features and other things, let's first discuss the flowchart. And here we have hematopoietic stem cells. They divide to form the common myeloid progenitors and common lymphoid progenitors. The common myeloid progenitor, they divide and form erythroblast, megakaryocytes, and granulocyte progenitors. This figure is actually 58.1 from Levinson, and it is not completely presented here. The common lymphoid progenitors, they divide and form B cell precursors, natural killer cells, and T cell precursors. These are the pre-B cells and pre-T cells, which are not pretty in this case. These B cell and T cell precursors, they actually proliferate excessively and do not differentiate into their successors, B cells and T cells, and they are the lymphoblasts, which are actually the cells in the ALL. As a background, we have two types of leukemia. One is acute and other is a chronic. In acute, we have two types. One is AML and other is the ALL. You can simply see above that if these are the cells like erythroblast, megakaryocytes, and granulocyte progenitor cells, these are the cells which do not differentiate into their successors, then we have AML. We have ALL if these lymphoblasts, they divide excessively. And these are differentiated on the basis of terminal deoxynucleotide transferase. This is a DNA polymerase which is absent in case of AML and it is present in case of ALL. This DNA polymerase is present only in the precursor cells. Yes, it is not present in mature B and T cells. It is not present in myeloid cells. As another difference, we have the lymphoblasts of ALL. They are actually myeloperoxidase negative. Similarly, we have periodic acid shift positive glycogen granules in case of ALL, which are absent in case of AML. Okay, as I told earlier, we have lymphoid progenitors which divide into B cell precursors and T cell precursors. On the basis of these two types of cells, we have two types of ALL, BALL, TALL, ball or tall simply. And these are differentiated on the presence or absence of specific CD markers. Like if CD10, 19 and 20 they are present, then that specific ALL is known as BALL. And if any CD marker between 2 to 8, 2, 3, 4, 5, 6, 7 or 8, they are present, then that specific ALL is known as TALL. We have already covered the first 2 points from here, and the third point is also very important. The patients with Down syndrome, they are very predisposed towards the development of ALL. BALL is more common than TALL. Yes, the BALL is most common in children and the picture is leukemic, whereas TALL is common in adolescent and the picture is of lymphoma. Now pathogenesis. The development of ALL is a multi-step process. First we have chromosomal aberration. As a result of that aberration, we have dysregulation of expression and function of transcription factors. These transcription factors, they are actually responsible for the differentiation of B and T cells. Like if I talk about TALL, in most of the cases we have gain of function of Notch1 mutation, Notch1 gene, and this actually encodes a transcription factor that is involved in the differentiation of T cells. Similarly, in case of BALL, we have loss of function mutation in the PX5 gene, and this also encodes a transcription factor which is actually responsible for the differentiation of B cells. So as a result of dysregulation of expression and function of transcription factors, we have maturation arrest. Secondly, there are also further mutations which actually cause an increase in the tyrosine kinase activity or RES signaling. As a result, there is increased cell growth. As we have already discussed that there is chromosomal aberration. So in case of childhood BALL, mostly the mutation are hyperdiploidy. Yes, there can be 1221 translocation, and here there is fusion of two genes. One is ETV6 and other is RUNX1. Similarly, in adult BALL, we have in more than 25% of the cases, we have translocation 922. And here again is a formation of the fusion gene. Here we have two genes, BCR and ABLG. This mutation also occurs in CML, and in that case, in CML, as a result of this mutation, there is good prognosis. But in case of ALL, we have bad prognosis with this mutation, and this is important. In TALL, there can be mutation in T cell receptor locus or loci or transcription factors, or there can be inactivation of tumor suppressor genes. Now let's move toward the morphology. In case of leukemia, yes, the marrow, it is hypercellular. The lymphoblasts, they have actually replaced the normal marrow elements. In case of lymphoma, yes, the mediastinal mass, it is going to be present. Splenomegaly and lymphadenopathy, they are also present along with the mass. The lymphoblasts, they are cells that have second basophilic cytoplasm, small nuclei, and higher nuclear to cytoplasm ratio. The lymphoblasts, they have very high mitotic rate in ALL. Now the clinical features. The clinical features are actually the presentations of the first two morphological points. Yes, depression of the marrow. As the lymphoblasts are going to increase they are actually increasing in the marrow. As a result of their increase, the other marrow elements, they are going to decrease. Suppose erythroblasts, they are actually decreasing. As a result, we have decreased number of red blood cells. The patient is having anemia, and it is going to present with fatigue. Similarly, granulocyte progenitor cells, they are actually decreasing. As a result of their decrease, the neutrophils are actually decreased. And if neutrophils are decreased, the patient is having neutropenia, and it is going to present with infections. Next, we have megakaryocytes. They can be decreased. As a result of their decrease, we have decreased number of platelets. The patient is having thrombocytopenia, and he is going to present with bleeding problems. Next is a neoplastic infiltration or mass effects. The lymphoblasts, they are actually proliferating in the bone marrow, and as a result of their proliferation, they start to infiltrate the bone around them. And as they are infiltrating, they are actually going to infiltrate the periosteum. And we have the symptom of bone pain. Similarly, as I have told earlier, in case of the lymphoma, there is presence of thymic mass, and this thymic mass is going to cause a compression of the large vessels and airways in the mediastinum, and the patient is going to present with the symptoms resulting from this compression. And CNS manifestation, they can also be present, and these manifestations include headache, the nerve palsies, and many more. Treatment, we have the chemotherapy, and we do the prophylaxis chemotherapy. Prognosis. The age is very important component in deciding the prognosis, whether it is good or bad. Patients younger than 2 years or older, they have bad prognosis, whereas the age between 2 to 10 serves as a good prognostic factor. Next is a blast count. The more the neoplastic cells, the more the bad prognosis. Yes. Genetics, they actually serve as very important component in deciding the prognosis as well as the treatment of the ALL. I have told this earlier that in case of CML, this mutation, it actually serves as a good prognostic factor, but in case of ALL, this is a bad prognostic. Similarly, this mirror translocation 1221, it actually has good prognosis in case of ALL. So that's all about ALL. If you like this video, click on the like button and also subscribe to the channel. Thank you so much for watching this video.